Welcome to the official Global RPH YouTube channel. If you haven't already, be sure to hit that subscribe button. Sexually transmitted diseases continue to pose significant public health challenges in the United States. Recent years have seen alarming trends in the incidence and prevalence of various STDs, with particular concern surrounding herpes and syphilis. This video aims to provide healthcare professionals with the extensive overview of the current landscape of STDs in the U.S., focusing on trends observed since 2021, demographic patterns, and the broader implications for public health and clinical practice. The United States has experienced a consistent upward trajectory in STD rates over the past decade, with this trend continuing, and in some cases accelerating since 2021. According to the Centers for Disease Control and Prevention, the total reported cases of chlamydia, gonorrhea, and syphilis reached an all-time high in 2019, with over 2.5 million cases reported. While the COVID-19 pandemic initially led to a temporary decline in reported cases due to reduced testing and healthcare access, recent data suggest a rapid rebound and potential exacerbation of pre-existing trends. The COVID-19 pandemic has had complex and multifaceted effects on STD trends. Disruption of STD services. Many sexual health clinics faced closures or reduced capacity during lockdowns, limiting access to testing and treatment. Behavioral changes. Social distancing measures may have initially reduced casual sexual encounters, but as restrictions eased, there was potentially a surge in sexual activity. Resource reallocation. Public health resources were diverted to COVID-19 response, potentially compromising STD prevention and control efforts. Telehealth adoption. The rapid expansion of telehealth services has created new opportunities for STD care, but may have limitations in reaching certain at-risk populations. Herpes simplex virus infections, caused by HSV-1 and HSV-2, remain highly prevalent in the United States. While HSV-1 has traditionally been associated with oral herpes and HSV-2 with genital herpes, changing sexual practices have led to an increase in genital HSV-1 infections. Recent estimates suggest that approximately 12% of individuals aged 14 to 49 in the U.S. are infected with HSV-2. However, the true prevalence is likely higher due to asymptomatic cases and underreporting. Since 2021, there has been a subtle but noteworthy increase in HSV-2 prevalence, particularly among young adults. Key statistics: HSV-2 prevalence. Approximately 1 in 8 Americans aged 14 to 49. Annual incidence: estimated 776,000 new infections. Increase in genital HSV-1 infections: 30 to 50% of new genital herpes cases. Herpes infections exhibit distinct demographic patterns. Age: peak incidence occurs in individuals aged 15 to 24. Gender: women are more susceptible to HSV-2 infection, with a prevalence of 15.9% compared to 8.2% in men. Race ethnicity: African Americans have the highest prevalence at 34.6%, followed by Hispanic Americans at 12.1% and non-Hispanic whites at 8.1%. Sexual orientation: men who have sex with men have higher rates of both HSV-1 and HSV-2 infections. Syphilis has seen a dramatic resurgence in the United States, with case rates reaching levels not seen since the 1990s. This trend has continued and accelerated since 2021, prompting renewed concern among public health officials and healthcare providers. The CDC reported a 70% increase in total syphilis cases between 2016 and 2020. Preliminary data for 2021 and 2022 suggest this upward trend has not only continued, but potentially accelerated. Primary and secondary syphilis: 41,655 cases reported in 2020, with an estimated 15 to 20% increase in 2021. Congenital syphilis: 2,148 cases reported in 2020, a 235% increase since 2016. Overall, syphilis rate: 13.6 cases per 100,000 population in 2020, projected to exceed over 15 per 100,000. Syphilis infections demonstrate notable demographic trends. Gender. Men account for the majority of cases, 83% in 2020, with MSM disproportionately affected. Age. Highest rates observed in individuals aged 25 to 34. Race and ethnicity. Native Americans and Alaska Natives have the highest rates, 53.5 per 100,000, followed by African Americans, 52.3 per 100,000, and Hispanic Americans, 22.9 per 100,000. Geographic distribution. Southern states have the highest rates, but urban areas across the country are experiencing significant increases. Several societal and behavioral factors contribute to the observed trends in STD rates: changing sexual norms and practices, increased use of dating apps and online platforms, decreased condom use, particularly among young adults, substance abuse and its association with high-risk sexual behaviors, stigma, and lack of comprehensive sex education. The healthcare system plays a crucial role in STD trends: limited access to STD testing and treatment services, inadequate funding for public health STD programs, antibiotic resistance, particularly in gonorrhea, lack of routine screening in primary care settings, insufficient partner notification and treatment programs. Broader socioeconomic and structural issues contribute to STD disparities: poverty and lack of access to healthcare, housing instability and homelessness, systemic racism and its impact on health outcomes, incarceration and its effects on community health, limited access to comprehensive sex education in schools. The rising STD rates present significant challenges for public health. Strain on healthcare resources and STD clinics, increased risk of HIV transmission, long-term health consequences including infertility and increased cancer risk. Congenital infections, particularly syphilis, potential for antibiotic resistance in STD pathogens. Healthcare providers must adapt to the changing STD landscape. Increased vigilance in screening and diagnosis. Updated treatment protocols, particularly for resistant strains. Enhanced patient education and counseling. Integration of STD services with primary care and other specialties, and adoption of innovative testing and treatment strategies. Effective prevention strategies are crucial to addressing the STD epidemic. Comprehensive sex education programs, expanded access to STD testing and treatment services, targeted interventions for high-risk populations, improved partner notification and treatment programs, and integration of STD prevention with HIV prevention efforts. Recent technological innovations offer new opportunities for STD prevention and control: rapid point-of-care diagnostics, home-based testing kits, mobile health, mHealth applications for education and risk assessment, digital contact tracing tools, and artificial intelligence for predicting outbreaks and targeting interventions. Biomedical research continues to advance STD prevention, development of new antibiotics for resistant strains, progress in HSV vaccine research, exploration of pre-exposure prophylaxis, PrEP, for STDs beyond HIV, microbiome-based interventions for STD prevention, and novel treatment modalities such as immunotherapies. Addressing STDs requires broader policy and structural changes. Increased funding for STD prevention and control programs. Integration of STD services into broader healthcare reform efforts. Addressing social determinants of health that contribute to STD disparities. Improving access to healthcare for marginalized populations, and strengthening surveillance systems and data collection efforts. Several key areas warrant further investigation: long-term impacts of COVID-19 on STD trends and healthcare delivery, the role of the microbiome in STD susceptibility and transmission, novel biomarkers for improved diagnostics and treatment monitoring, strategies for addressing antimicrobial resistance in STDs, and behavioral interventions tailored to the digital age. To address the growing STD epidemic, the following recommendations should be considered: increase funding for STD prevention, testing, and treatment programs. Expand comprehensive sex education in schools and communities. Integrate STD services into primary care and other healthcare settings. Implement targeted interventions for high-risk populations, and strengthen partnerships between public health agencies, healthcare providers, and community organizations. The recent trends in STDs, particularly herpes and syphilis in the United States, present significant challenges for healthcare professionals and public health officials. The continued growth in STD rates, exacerbated by the COVID-19 pandemic and persistent socioeconomic disparities, demands a comprehensive and multifaceted response. As healthcare providers, it is crucial to remain vigilant in screening, diagnosis, and treatment of STDs, while also engaging in patient education and prevention efforts. The integration of new technologies, biomedical interventions, and policy changes offers promising avenues for addressing this public health crisis. By staying informed about the latest trends, demographic patterns, and emerging strategies in STD prevention and control, healthcare professionals can play a pivotal role in reversing these concerning trends and improving the sexual health of individuals and communities across the United States. Thank you for watching our presentation. If you found it enjoyable and informative, please consider liking the video and subscribing to our brand new YouTube channel. Our content spans a wide range of topics designed to appeal to a diverse audience, ensuring there's always something fresh and engaging for everyone. Your support helps us grow and continue to provide interesting and valuable content. Stay tuned for more exciting videos.